Hello friends. Today we are going to discuss about school mental health program. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I am going to discuss about what is school mental health program, what are the different ways the school mental health program has been defined, what is the need for school mental health program, components of school mental health program, what are the outcomes and indicators to say the school mental health program has been effectively implemented. And this video is targeted to the school and colleges, administrators and teachers, policymakers, parents, children, non-governmental organization, corporates, and community at large. That means school mental health program is every citizen's business, not just the school, not just the parents. Let's discuss about school mental health program. Let's discuss about the demographic profile of our India. We're almost touching 140 crore population. In that, 39% are children. That is, children means below the age of 18 years. Approximately 54 crore, that is 540 million children are there in India. And unfortunately, 3 crore children, that is 30 million children are abandoned. That means they are orphans, or else the parents are unable to look after them. They are wandering at large on streets. With this demographic profile, we need to understand, we need to provide not only physical health, mental health, and also social well-being of these children. And these children are usually left to the mercy of parents. And the parents need to spend for their education, for their health and welfare. The government usually do not spend on children because they are not the voters. They are not vote bank. And also, even the government wants to invest in children, immediate returns are not there because the government's term is only 5 years. Within this 5 years, they would like to invest and show the returns. But unfortunately, if you invest in children, it will take long time for returns. Hence, the priority for government with regard to children is at the lowest, not only in India, in majority of the countries. In this regard, World Health Organization in 1995 launched the Global School Health Initiative, which aimed to strengthen the approaches to health promotion in schools. Among those approaches, pairing the children with health services occupies an important place. The school should not only educate but also should take care of health because health and education go hand in hand. And if you look at the definition of health, the WHO in 1948 clearly said that health is a state of complete physical, mental, and social well-being, and it is not merely the absence of disease or infirmity. So, it's a comprehensive definition given by World Health Organization. Let's understand this definition of health. Health means it encompasses physical health, mental health, and social well-being. So, these are three important components which the World Health Organization recognizes. But however, in India, we recognize it as a holistic health, and we do consider spiritual health is one of the other important component which needs to be added to the formation of complete health. However, we need to understand mental health is usually forgotten. That means it is neglected. Although children are neglected, in that, again, if you are going to give some importance to health, mental health is the last priority. In this regard, school mental health program was adopted in many countries. And even World Health Organization gives importance that when you deliver health, mental health should be the integral part of all health delivery system, not only in the health department, but also in the education, at workplace. Basically, we need to integrate mental health with general health. With regard to school mental health program, various definitions have been given. One of the commonest definition which has been often quoted is school-based mental health services are those delivered directly in schools, not in mental hospitals, not in general hospitals or in medical college. That means mental health delivered inside the school will be considered as school mental health programs. However, there has been some other people who have defined it. Here they say that any program, intervention, or a strategy applied in school setting that was specifically designed to influence the student's emotional, behavioral, and or social functioning. That means it needs to be very specific to children with regard to emotional, behavioral, and social functioning. So this is a very important definition of school mental health program. The term the school-based services is inclusive of services deliveries both by school employed and also community employed providers. That means this mental health program which is going to be delivering to the children will be both by the two partners. One, the people who are inside the school. That means principal, school administrators, teachers, school nurse, school counselors, and also school psychologist. And with regard to the second important is community based employed providers. That means psychiatrist, psychologist, social workers, nurses from the health department providing care. That means it has both the human resources which needs to be catering the services of children at this school. Now the question is, why do we need school mental health program? What is the requirement? Already the school is providing a lot of education. They do not have time, and also the teachers are not trained in school mental health. Why should we emphasize? That is the question which is often asked by school administrators and also education department. Let's understand that why we need to emphasize on mental health in school. The first and the foremost, psychiatric epidemiology in children. That means the prevalence of psychiatric disorders in children. If you look at that, one of an important article published by Dr. Savita Malhotra, one of the pioneer in school mental health. In her studies, basically a review study of many studies which are done in India, which clearly said that the mental health problems in community is around 6% of children has one or the other problem who requires psychiatric attention. That means 1 in 20 child. That means 1 in 20 children needs psychiatric care. If you move towards the school, here in school, 1 in 5, that means 23% of children have one or the other mental health issues in school. That means in community 1 in 20, in school 1 in 5. That means there is something wrong in our school. In community, the children are healthier, but in school, they become sick. Why? We do not know. Is it the pressure of studies, education, expectation by the parents, society, or the school environment? Is it conducive for mental health? That needs to be answered by everyone. And also, one need to understand the onset of psychiatric illnesses are common and often develops during the childhood and adolescence. Invariably, between the age of 12 to 20, many of the children or adolescents develop mental illness. If you don't recognize early and treat them, their life will be destroyed. The simple reason is, during this period, 12 to 20 years, invariably their personality will be developing, their education, their academic career. At the same time, the brain is developing. During this period, if you don't recognize their mental illness, and if the mental illness continues, it may become lifelong. That means their life is ruined. That means at this point, we need to identify and treat at the earliest. And school is the best place to do it. The reason being, in school, there are many people who can monitor early identification, early intervention in community setting. That means they need not go to mental hospitals. This can be done in the school setting, and it is easily accessible to the child and also to the parents. It is affordable and it has less stigma. There is high acceptance of mental health intervention within the school. Parents will be receptive because if you are able to engage them and tell, the mental health intervention is directly dependent upon their academical output. That means the parents will listen to you. At the same time, follow up and monitoring of the children can be done for many years. That means if the child is around 7 years old, and if you're able to pick up there is a mental health issue, we can do follow up till the age of 18. That means the school can monitor the child and also support the child whenever the child requires help. And another important dimension we need to understand, why do we need mental health in schools and colleges? Every day we get up, we brush our teeth, we take bath, we comb, we take good care of our personal hygiene for physical health. We do exercise and also various things. What about mental health hygiene? Do we take care of our mental health? Do we do more meditation? We do spend understanding our own emotions, behaviors, thinking. Do we do that? Unfortunately, nobody teaches us about our mental health. We focus only on physical health. That means there is an important component is missing in our education. That is mental health hygiene. That needs to be educated from the day one of the school, depending upon the child's developmental needs. Second important reason, we know about physical first aid, but we do not know about mental health first aid. Let me give you an example. If a child of the age of 8-year-old falls down and sustains injury to her leg, immediately the child runs to the mother. The mother will apply band-aid, and even the mother can take the child to the doctor. If the same child is being bullied by her teacher or by peers in her class, the child is traumatized. How does the mother will give mental health support? Does the child seeks for help, telling that I have been bullied, I don't want to go to school, my friends are harassing me, and I'm feeling frustrated, I'm feeling sad? Will the child able to understand this, communicate to this to the parents and teachers? Because we do not talk about mental health first aid. We ignore this. All parents or most of the parents know about physical first aid, but not about mental health first aid. Again, there is a serious concern about mental health issues within our population. This is the second important requirement why we need to discuss about mental health in school. Third, physical illness versus mental illness. If a child develops physical illness such as tuberculosis, typhoid, COVID, every person in the school, including teacher, friends, everybody has empathizing skill towards the physical illness. Everybody will be able to support the child. The child will be given leave. Whereas if a child develops emotional disorder, maybe depression, maybe behavioral problems, nobody empathizes with the child. The teachers, parents will try to discipline the child either by beating, scolding, or giving punishment. That means mental illness is not given importance at all, whereas physical illness gives all importance, gets sympathy, empathy, and also accommodation occurs. Whereas with mental illness, there is nothing. Hence, again, we need to educate the public, teacher, school administrators, and parents with regard to mental illness. And it also should be given equal importance like physical illness. Further, it is easy to get leave for physical illness. For mental illness, the leaves are denied if a child is fully stressed because of family problems or else because of academic stress. If the child wants to take leave, it will not be given. The school teacher will say the child is malingering or else deliberately doing it without understanding the child is going through a severe stress, because stress can affect everyone, including the child. Unfortunately, we do not give importance again with regard to mental illness and leave. For that matter, even mental disability does not get equal importance similar to physical disability. This is across the globe. Further, the another important is intelligent quotient versus emotional quotient. Intelligent quotients, that means IQ, which is often referred, is ability to learn, memorize, and reasoning ability. Here, a person learns things, keeps it in the memory, use those information to solve the problems in hand. That is intelligence quotient. Our education system is fully geared for IQ. That is for learning, memorizing, to some extent problem solving. Unfortunately, our education system, curriculum, and even the core competency skills do not discuss about emotional intelligence, also called as emotional quotient. Emotional quotient refers to the ability to recognize and regulate emotions in ourselves and others. That means we do not teach how to deal our own emotions, how to recognize our own emotions, how to recognize others' emotion and deal the emotions of others. That is intrapersonal emotional management, and also interpersonal emotional management is not taught at all. I do remember my teacher used to say, you require IQ to get a job, to get promotion, to become the best employee or the best employer. You need to have an amazing emotional quotient. To be a good leader, you require both, but emotional quotient requires the most. That means we do not give any importance to emotional quotient. Intelligent quotient is basically given by God. That means every person has certain amount of IQ and it is God gifted. Whereas emotional quotient is the one which can be trained, which can be inculcated so that the person becomes a good person. Apart from this intelligence quotient, emotional quotient, there is one more component which is considered as social quotient also, or else social intelligence. Basically, it is understanding about others' emotion and dealing their emotion, and also dealing with conflicts. That is called as social intelligence. However, the social intelligence becomes a part of emotional intelligence. So that means in our school, we do not discuss about emotional quotient. We do not teach the children to recognize their own emotion, how to handle their emotion, how to recognize the emotion in their friends, parents, in the society, and how to deal those emotions is not taught at all. Again, we have a serious problem in our educational system. Now the question is, how does the school mental health program helps children? One need to understand, brain continues to develop till the age of 18 to 20. This is the important period when mental illness also will develop. Hence, we need to identify and treat at the earliest. And this is the period when the child requires support, nurturance, so that the resilience can be built in the child. And the child will be under tremendous stress to perform in the school. This is the time the child requires support, nurturance, not punishment. Hence, mental health support is very essential during this period. If the child develops mental health, and if you don't treat the child at the earliest, the child's life will be destroyed. Hence, the school needs to understand about the mental health issues, need to be flexible with regard to deadlines, requirement, and supporting the child with mental illness. And also, the teachers need to recognize the emotional problems in the children, behavioral problems in the children, developmental issues in the children, and need to give some accommodation with regard to their problems. At the same time, the school administration, the community at large, should equip the children with the certain tools to overcome their emotional problems and also need to implement certain strategies to manage the emotional and behavioral problems of the children within the school. Because the children spend one third of their life in the school. This is the time or this is the place where the school mental health program plays a crucial role in modifying the child's mental health. At the same time, we need to discuss about mental health in children so that the children will seek help whenever they are in emotional distress, so that early identification and intervention becomes the norm. At the same time, teaching resilience in children plays a very crucial role, and giving breaks, leaves, opportunity to overcome distress and also to overcome stress is very essential component, and the child should be given at least 2 days of leave as and when the child becomes extremely stressed. And this need to be coupled with the management. That means availability of counselors should be there in schools. So these will help the child in the long term basis. Hence, we need to understand children need to be taught how to take care of their mental health. That is, how to identify and deal with their emotions, how to improve their cognitions, and deal with their behaviors of their own and also others. And this need to be done at the earliest. This post-pandemic or post-COVID era will be very challenging to children, to the parents, and the community at large. Hence, we need to gear up immediately. Further, the research also demonstrates that the students who receive social, emotional, mental, and behavioral health support achieve better academically. And not only that, they will become an excellent citizen in the society. We are not just giving education, we are providing a good mental health support, mental health awareness, and also mental health intervention strategies so that they will become excellent citizen of the country. Further, the school mental health program improves school climate, that is environment, classroom behavior, engagement in learning, the student and teacher's relationship, the student's sense of connectedness and well-being also improves when school mental health programs are implemented. Further, the children will do excellent in their academics also. Hence, the school mental health becomes very important component. At the same time, school mental health program prepares and enables ones to cope with life's challenges. Here, we discuss a lot. Here, the child is under stress, but we do not discuss about stress and stress management. Whenever the child is going for an exam, invariably the parents will ask the child, if you pass, what will you do? What course you will take? What you want to become? But unfortunately, none of the parents, teachers will not discuss, by chance, if you fail in the exam, what will you do? How do you cope? If your friend fails, how will you support him? What are the various alternatives available? Those are not discussed at all. Those need to be discussed. That means in life, the failure do occur. Success also do occur. One need to teach the children how to accept failure, how to bounce back, how to be resilient. Invariably in life knocks you down. But that does not mean you are a failure. It's just like a boxing. You are given a punch, you fall down, but you bounce back. Unless you accept the defeat, the match is not over. Similar here in school mental health program, we need to teach the children how to cope with stress, how to deal with stress, how to cope with failure, how to deal with failure, those need to be taught to the children. Further, if the school mental health program is not addressed and if it is left unmet, mental health problems are linked to costly negative outcomes such as academic decline, drug abuse, behavioral problems, internet addiction, school dropout, delinquency, and also teen pregnancy, early sexual encounters, and severe behavioral problems and getting arrested. So, these are the problems which we are going to face if you don't address mental health issues in school. Further, the children are under tremendous stress, anxiety, bullying in school, family problems, parental fights, marital discord, depression, suicide, deliberate self harm, learning disability, alcohol and substance use, internet addiction, porn addiction also are increasing. Hence, the school mental health program should be considered at the earliest. Mental and behavioral health problems not only affect the student's short-term classroom engagement but also interferes in the long-term development of positive relationship and work-related skills. That means if you don't intervene, the child will have lifelong effect. That needs to be understood. It's not just the academic decline. The child will have difficulties coping with the stress and also the demands of life in the long run. And even we need to teach the child to deal with the crisis. Hence, school mental health program becomes handy here. If there are any crisis in the school or at home or in the environment like natural disaster, the school employed mental health professionals provide support and supports that facilities a return to normalcy is done, especially with children. And these should be sustainable and can to help to identify and work with the students with more intense or ongoing needs of the child should be done. So this is a very essential component. That means the child should learn to deal with the disaster, deal with the stress, day-to-day demands, so that the resilience of the child becomes a norm. Now the question is, what are the characteristics of school mental health program? The school mental health program, the properties and characteristics should be, it should be child-centered, inclusive of parents, that is family, it should be sustainable, culturally competent, and should have a range of mental health services available in the school, and services to be tailored to the individual child's need. That is very essential. So these are the important characteristics of school mental health program. Now the question is, why do we choose school to deliver mental health program? Why not hospital? Why not home? Why it should be school only? First and the foremost, it is easily accessed by children and parents. First, there is high chances that children will seek mental health help and utilize it very effectively, because the child alone cannot go to the hospital, but the child goes to the school. And if you are able to provide this help inside the school, there is high possibility the child will use it. At the same time, parents will be very receptive with regard to mental health care inside the school. On the other hand, if you tell the parents you have to take your child to a psychiatrist or a mental health counselor or a psychologist, the parents will be very angry. But if you are able to provide the same services within the school, they will be able to accept it. And it should be affordable. In schools, the training teachers, counselors, and nurses, and providing some sort of mental health services which can be affordable, and it should be cost effective, and in many places it is free, and it is very sustainable. At the same time, it is quick, because many a time crisis intervention, if the child is going through a trauma, academic related stress, the intervention can be done at the earliest. And you can observe the child in a real setting in the school, how the child performs inside the school, the behavior of the child inside the school, emotional behavior of the child, and also how the child is performing in academics. Hence, the intervention, if you are planning, it can be done in the real setting, that is in the school. At the same time, on-site feedback to the child, teachers, parents can be done. And also, monitoring of the child can be done for years. That means you can keep the track of the child, how the child is going to become over a period of time can be planned in schools. At the same time, school will be less stigmatizing. At the same time, provision of services in school further reduces stigma and discrimination inside the society, and the high possibility of increased utilization of services occurs, and so we are going to get a good citizen, and it is a good investment with regard to children. Hence, the school mental health program should be planned in school because there is a promotion component, prevention of mental illness, early identification, intervention, and rehabilitation can be easily integrated into the school system in our country. And schools are the ideal places to provide mental and behavioral health services to children and youth. Not only emotional, spiritual, and also social intelligence need to be inculcated in our curriculum. Now the question is, how do we plan mental health programs inside the school? We can plan it in three important components. We call it as a multi-tiered approach. The tier 1 is universal. Here, you are going to target all children. It is health promotion, mental health promotion. Here we are going to teach social intelligence, emotional intelligence, behavioral intelligence. So the child learns that and implements it. That is for everyone. And it is done by every person in the community. Moving to the second, tier 2. Serving at-risk student. That means the children are who are at risk, high risk. That means if a child has substance abuse, if the parents are using substance, single parent, the child who has been abused, bullied child, child with mental illness, child with disability, child going through gender difficulties, the child from a lower socioeconomic status, background community, or backward society. Those are the children's we need to target. Here it is tier 2. In tier 2, the people who are going to provide services are teachers, school counselors, school nurse, at the same time school psychologist. So here you are going to prevent mental illness. Tier 1 promotion, tier 2 prevention of mental illness in high risk category. Moving to the tier 3. Here you are going to serve those children who have been identified having mental illness. Here you will be referring to a psychiatrist, clinical psychologist, or psychiatric social work, or psychiatric nurse. Here the intervention may be cognitive behavioral therapy, medications, and various other rehabilitation packages can be given here. Tier 3 is done by mental health professionals. However, the monitoring will be done by teachers. Rehabilitation also occurs at the school level. Hence, we need to plan with a 3-tier approach. Let's look into that in this pyramid. The tier 1 is universal. All children will be getting mental health promotion. Tier 2 is for high risk population, and it will be delivered by teachers, school nurse, and school counselors. Tier 3 for children who have been suffering from mental illness, and the services will be provided by mental health professionals, that is specialists. Moving further, we need to understand the services provided in tier 1 and tier 2 will be in the school, and tier 3 will be by professional in the hospital, and also it may be even in the school also. But however, the requirement for tier 3 is very less, but the cost is huge. Hence, we need to focus more on tier 1 and tier 2. Promotion and preventions plays a very important role, and the cost will be less. Hence, the school mental health program will not only provide promotion and prevention, and it also gives an opportunity to refer, make sure the child takes medicines, undergoes therapy. At the same time, monitoring can be done at the school. Now the question is, what is the prevalence of mental illness in children? Especially in India, there was an important article which was published in 2014 by my teacher, Professor Savita Malhotra. This is a systematic review and meta-analysis. It was published in Child and Adolescent Psychiatry and Mental Health Journal. And in this study, they clearly said that the prevalence of mental illness in community, especially in children, is 6.5%. That is, 1 in 20 children have mental illness in the community. Whereas in school, it is 23%. That is, 1 in 5 child going to school will have mental illness. And these are the people who require professional psychiatric care. It's a huge number. Now the question is, how to plan sustainable school mental health program. As I said, only the Tier 3 requires specialist. Tier 1 and Tier 2 requires school and community people who can provide mental health care within the society. We need to plan for this. The planning has to be done. The school mental health program can be implemented by school staff and parents. That means Tier 1 and 2 can be done by the parents, people in the community, teachers, school nurse, school counselors, school psychologists, and school social workers. At the same time, the inclusion of full-time mental health professionals for handling essential or high-risk population also to be considered. If possible, the psychologists need to be hired in the school, depending upon the need. And if the child develops mental illness, the referral plan should be in place. That means you need to link up with district mental health program, local psychiatrist, local corporate hospital to provide services to the child who are having severe mental disorders. Now the question is, who are the stakeholders to be involved in school mental health program? Is it just the school or community at large? Let's look into the list. The first and the foremost stakeholders are parents, children, that means peers who are within the college or school, school's teachers and staff, school administration, school nurse, school counselor, school social worker, local police. At the same time, special juvenile police unit also need to be involved in providing care inside the school. District child protection unit, officers need to be involved, legal service authority, child welfare committee, juvenile justice board need to be involved in school mental health program. Further, district mental health program, local doctors and pediatrician, IT teams to discuss about how to keep the child safe in digital world, how the child needs to interact in digital world need to be trained, involving spiritual leaders, non-governmental organization, corporates, panchayats, RBSK group, that is Rashtriya Bala Swasthya Karyakram, counselors need to be involved, ICDS, teachers, Anganwadi teachers need to be involved, community and others. That means school mental health program is everybody's business. It's not just the school and parents. The community at large need to participate and provide services to the children. What are the components of school mental health? That means what should be the curriculum in school mental health program? We need to understand this. It needs to be tailored depending upon the culture, depending upon the development of the child, what is the age of the child, how the child is developing, what is the language of the child, culture of the child, religion of the child. All these need to be kept in mind before you deliver school mental health program. Here are some of the components which have been identified across the globe. First and the foremost is the children need to be taught about the identifying the emotions and managing their own emotions. Second one is becoming aware of others' emotion and managing others' emotion. Understanding stress, managing stress, dealing with their own impulses effectively is very essential. To deal with mental health crisis effectively, dealing with relationship issues, managing relationships, communication skills, and interpersonal skills. Identifying and preventing suicide, preventing substance use and drug abuse, to prevent internet addiction, pornography addiction, to prevent child sexual abuse, to prevent domestic violence, bullying, gender sensitization program, and of course, teaching life skill is very essential part of school mental health program. Further, at least every child should be taught about these following things: handling anger, that is anger management, managing conflicts. Conflicts can occur with the parents, with friends, with teachers, or with opposite gender. So managing conflict is very essential. Developing empathy and also controlling their own impulses has to be taught. Hence, the school must help the children recognize and manage their emotions, and others' emotion is very essential. Now the question is, yes, we have done the school mental health program. What should be the outcome indicators? What we should look at? How the children are doing once we have implemented school mental health program? Some of the indicators are here: improved classroom behavior, improved confidence and self-esteem in children, improved relationship between the teachers and students, improved leadership skills, change in study habits, concentration in studies, academic improvement, less instances of disciplinary action, fewer substance use, prevention of deliberate self-harm and suicide, less of school dropouts, improvement in interpersonal relationships, improved mental health, help-seeking behavior, and also reducing high-risk taking behavior such as teen pregnancy, sexual intercourse, and developing sexually transmitted diseases. Such high-risk behavior will be reduced, and these are important components which need to be there in school mental health program. Further, if you are able to have a luxury of training life skills in children, and parents and school teacher becomes an amazing. So WHO, that is World Health Organization, has given important 10 skills which are life skills which need to be imparted to the children. Unfortunately, in India, we focus more on knowledge, memorizing and vomiting on question paper or answer sheet. That is not life skills. Although we may teach only knowledge, but the requirement is life skills. Those life skills are critical thinking, creative thinking, decision making, problem solving, communication skills. For that, we need to also teach interpersonal skills, coping with emotions, coping with stress, self-awareness, and empathy. If you're able to do this, you're going to develop a nation with resilient citizens. Our education system should gear up for developing an amazing citizens. Unfortunately, our education is focusing more on having economic build or else providing employment. That means education means employment. Unfortunately, education should become developing amazing citizens for our country. To conclude, my dear friends, in school mental health program, we need to focus on emotions, ability to be aware of their own emotions, understanding their own emotions, and expressing their own emotions and managing their own emotions. At the same time, ability to be aware of others' emotion and dealing the emotional distress of other people is also very essential. Further, ability to deal with strong emotions and control one's own impulse is also a very important part of school mental health program. Ability to adapt to change, solve problems of personal and social natures is also a very essential component in school mental health program. And to conclude, my dear friends, school mental health program needs to be implemented at the earliest. And in post-COVID, it's very essential. So I request all the audience to consider implementing school mental health program in whichever school you're working or your children are going there. Thank you very much for giving your valuable time. Stay safe.